everyone. I want to welcome you to the Glow Zoomcast. And Amanda, welcome. Thank you so much for being with us today. For those of you who did not watch our last video together, Amanda Kessner is a home birth midwife in the Bay Area, in the East Bay of San Francisco. And Amanda is here to talk with us today about postpartum care and primarily about the differences between home birth postpartum care and hospital postpartum care. So without further ado, Amanda, can you please tell us a little bit about the feelings that most people will have postpartum?
Sure. Well, first I'll say, Sarah, thanks so much for having me. I'm so happy to have this conversation with you. Postpartum is really a part of the childbearing year. Your pregnancy and postpartum encompasses the childbearing year. And it's in some ways just as kind of sacred and vulnerable a time as pregnancy, and maybe more so because now you have a baby. You have a brand new baby, and for many first-time parents, this is the first time they're caring for a newborn baby, the first time they're breastfeeding, the first time they're kind of waking up several hours of the day to care for their new baby, and they're also recovering from pregnancy and childbirth. And so it's hard to say what your pregnancy was like, and certain people will have different experiences in childbirth. Some people will have vaginal births, and some people will have cesarean births, but you're also kind of healing from that experience in addition to caring for the new baby. So I think it's a really unique and special time that comes with a lot of joy and a lot of challenges. And also hormonally, it's unique because you are effectively coming down from the hormones of pregnancy, which can inform some women feeling what we call postpartum blues, kind of emotional ups and downs of the first 3 months after having a baby, or some people will experience postpartum depression, which is a little bit more severe.
People oftentimes confuse the term postpartum with postpartum mood disorders, which we also call PMADs for short. And I try in my work to give people an understanding that every single person who has a baby is postpartum, and that there are a set of characteristics that are part of that time, which are different than the symptoms of a postpartum mood disorder. However, some of those symptoms of a postpartum mood disorder can actually exhibit themselves in a normal course of the postpartum experience.
Mm-hmm.
So like you say, baby blues, I would say that the majority of people go through at least 2 to 5 days of feeling like a roller coaster of emotions is happening. And sometimes that will be prolonged for significantly longer. So tell us like what the scene is and more of a sensory depiction when you go into a home postpartum. So not so much what are you doing, but what do you see? What do you smell? What do you hear? What's sort of going on with the players involved, the characters in the space usually?
That's a great question. And I think that I'll describe what's happening in an ideal scenario. And then I might touch on what is often happening. Mm-hmm. So in an ideal scenario, when I'm seeing a mom postpartum, I'll say for a 24-hour postpartum and well baby visit, I'm walking into her home and her partner or a family member is answering the door. The mom is not greeting me at the door. I'm walking into their house, and ideally I can smell that there's like a soup or a stew on the stove. Somebody, not the mom, is preparing a really nourishing meal for her. I'll walk into their bedroom where I'll find the mom in bed, lights low. Maybe she's not even wearing clothes, or she just has a robe. She's topless with a robe on, and the baby is right on her skin or in some safe sleeping area in their bed, like in a DockATot baby sleeper, or in a co-sleeper, like a crib that's next to the bed. Ideally, the mom is kind of set up with a special station for breastfeeding that includes lots of snacks by her bedside, a giant water bottle, and plenty of nipple butters and salves for treating new breastfeeding nipples, which can be a little sore and tender. It feels not so dissimilar to the energy of birth, kind of that low lighting womb-like space. And I actually feel like, as much as I can communicate here, there is that kind of like palpable, like ineffable essence of birth, like something has just happened, something in this woman's life has changed, and it still feels like we have to use our kind of soft voices and our gentle touch and not have a regular conversation, because this huge transformative event has just occurred. I think that in a more common scenario, the mom is answering the front door. Maybe she's even holding her baby. She has tears in her eyes. Maybe she's already having challenges with breastfeeding. I think probably the most common is some type of combination between the two.
Yeah, that sounds like what is most commonly happening. We at Glow end up seeing the results of people being up and on their feet too early, and
Right.
we see also the less tangible results of the stress and the anxiety that can come with needing to be in a more cerebral state and in a more social state than would actually be necessary or required in a more traditional postpartum experience. Something that you said that really was evocative to me was not having a regular conversation. I think back on postpartum visits that I've made and my own postpartum experiences, and especially with your first child. So I also want to caveat that usually for the first baby is where you have that giant transition. So I think of it as the first birth is a revolution, and the second and third and fourth, whatever, those are an evolution. So you kind of have to like break and build the system, whether it's, you don't need to break the physical system, but certainly the structures of organization, of interaction that you're having with the outside world, et cetera, your expectations of yourself and the people around you, that all has a huge transformation with the birth of the first child. And so with that comes this entire identity shift and this experience of like being incapable of having a regular conversation for some time. And for those of us who have had friends who've had babies and we're not in that phase of life at that time, whether your kids are older or you don't have kids yet, it's like borderline obnoxious. You know what I mean? Like you want to be there for them and you want to support them, but you're also thinking like, I'm not thinking about green poop all day or like just generally poop ever. You know what I mean? And like, I'm not thinking about, I'm not crying every time I talk. Like holding space for somebody who is postpartum after their first child, where their hormones are having such huge swings, is so intense. And I love what you say about, you feel as though you're not supposed to be having regular conversations. The conversations should look different and following the cues of the mom. So that's a little bit of a tangent, but when you then shift to this vision where mom's coming to the door, she's a little bit harried, she has her adult diaper on, she's carrying a baby, her boobs are leaking through whatever shirt she has on because she has to come to the door, so she's got to put something on her body. That's not ideally and amply supported postpartum care. So what are some of the things that lead to that kind of greeting at the door?
Yeah, I mean, I think that it really comes down to education. And there's this messaging in our culture where we really want women to have babies, but we don't really want to provide any support or services for them to make this possible. And we want them to kind of act normal and look like their pre-pregnant selves right away. We don't honor what a huge transition this is. And there's not a lot of social knowledge anymore for so many different reasons. Like we're not living in small shtetls, small villages. We're not coming from families of 10 where you helped kind of raise your siblings and you're really abreast to the kind of traditional postpartum traditions of your family and your culture. None of that exists anymore. And I think most people are living far away from family, if not, totally out of state. I think that we've just lost all social knowledge on postpartum. And I think that people aren't prepared, especially people that aren't getting tons of counsel prenatally. They're not prepared for the emotional transition, and they're not really prepared for the fact that you're still bleeding from your placental site. Why are postpartum moms and people wearing big diapers? You're leaking breast milk because your body is trying to determine the right amount that you need to make for your baby, and it kind of takes a while to really even out. They're not prepared that babies are waking up every 2 to 3 hours, but probably more. And because we don't know these things, when people transition to postpartum, They want it to feel like their normal life, because the transition that they've been expecting is like, oh, the new thing is the baby. The new thing isn't everything else in our life that has just changed. So I think the expectation is I should be able to get dressed. I should be able to answer the door. I should be able to sit down and have a meal. And actually, it sounds counterintuitive, because you're moving forward. The most kind of healthy and protective thing you can do in that period is still kind of treat yourself like you are in the womb. Your baby is no longer in the womb. You guys are in this womb together now, that early postpartum period. And I think that's what gets lost.
Okay. So this body is healing. I want to make one definition for people who are listening. The placental site is where the placenta has been attached to your uterus internally. And so your uterus is actually continuing to shed all of the contents of the womb, all the contents of the amniotic sac. And a lot of that will be blood that is still coming from that attachment site where the placenta was vascularly attached to the uterine wall, to the muscular wall. Your placenta peeled off and all of your little vascular endings are still closing up and getting nice and tight so that you're not continuing to bleed or hemorrhage. And it's sort of cleaning itself out as well, which is an important element of the postpartum period. Okay, so this is a question that I think about all the time. I would love to hear your answer to this. Do you think that it would be advantageous in our current actual reality? So not in the reality in which there is communal, social, colloquial knowledge of what postpartum looks like because you've seen it a million times and you see and you've supported your sisters and cousins and friends through it. But just in a birth education class that you or I are teaching, or a friend were to just be like, hey, I'm going to lay out postpartum for you, real deal. Like, I'm about to tell you all the things. Do you think that that would be advantageous for a pregnant family? And why or why not?
Yeah, that's such a great question. I mean, I think yes and no. Yes, because people need to know. Yes, because people need to know how to prepare. And because the truth is powerful. And in some ways, no, because you can't experience something until it's actually happening to you. And we don't want it to be fear-based. Yes, you will be bleeding. Yes, you'll be leaking fluid and breast milk. And yes, you'll be constipated and you'll be having strange digestion and your organs are settling back into place and you're getting to know your baby. And the first few days, your baby seems pretty normal, but suddenly your baby has turned into a vampire. There needs to be some balance where we're talking to people about what's real about postpartum and not scaring them, but even better, we're supporting them. And so, that's going to look different for every person and every family. And I'm wondering, as a midwife, I'm kind of constantly asking myself, how can I do the most supportive thing postpartum that's empowering to the family? And that includes a good amount of prenatal education, while also knowing they're not going to know what this is really going to be like until it's actually happening. So when we're actually in that moment, how can I provide the best care?
So talk to us more about that. I think that from what I have observed, it is the most powerful thing that can happen to a woman, to a person who's given birth, is that postpartum, they have somebody there who is a knowledgeable individual. So somebody who has had experience, it's like the same as a doula, somebody who has had experience with postpartum many times, somebody who is knowledgeable about postpartum and how to support somebody, and somebody who is trusted to that individual. So somebody who is going to come in and look you in the eyes and say, yeah, this is so intense and there's so much happening, but you're okay, and or you're not, and this is what we're going to do to make it better. And also, this is not going to last forever. This period of time where you're feeling this intensity is finite. Just like labor, truly, it's the role of a doula or a midwife in labor as well, to remind mom that she can do it and that, in fact, this intensity is going to end and it's going to be worth it. So what does that look like? What does that kind of support look like in a midwifery model of care?
Mm-hmm. I think you're really pointing to there's these kind of two tiers of support. There's the birthing person's family. So maybe a partner, maybe a postpartum doula, or a family member who, like you were saying, like has had babies or is familiar with the postpartum period. So there's the kind of family support, and then there's the clinical support like that a midwife would provide. And so separate from hospital postpartum care, when you give birth in the hospital, you're there postpartum for 24 hours or 48 hours, certainly less than 12 hours in our current setting. And you're discharged, and the mom won't see another provider for herself until 6 weeks postpartum. So that's a really long time that the mom isn't getting any attention. And usually their baby is getting some amount of pediatric care during this time. With home birth and the out of hospital model, you're seeing your midwife several times postpartum, and the midwife is coming to your house. So I'm seeing a mom at 24 hours after she's had her baby, just in the scenario that I explained. Ideally, I'm walking into her house and I'm meeting her in her bedroom, and I'm sitting on a chair next to her bed, or I'm even crawling into bed with her. I'm taking her vitals. I'm making sure breastfeeding is going well. I'm making sure that her uterus is firm and that it's the normal bleeding that she's going to experience is within a safe range. That if she had any tearing, that I'm making sure that it's healing well, that there's no infection, that she's remaining a healthy, low-risk postpartum individual. And I'm also providing her well baby care. So CPM, LM, so out-of-hospital midwives are also trained in routine pediatric care, which is great for folks that are trying to avoid a visit to the pediatrician, especially in this climate. So postpartum out-of-hospital midwives are seeing the mom at 24 hours at day 3. Day 3 postpartum is also a super special day because it's the day that your milk really comes in. So it's a lot of changes in terms of breastfeeding. 24 hours, day 3, 1 week, 2 weeks, and then a final 6-week visit. That for some midwives will be in their clinic, and for some it'll be at the mom's home. So it's tons of care compared to the just 1 6-week postpartum visit that you would get with a hospital provider.
And are you taking your baby to the pediatrician at some point throughout that phase, like throughout that postpartum phase?
Yeah, usually some families will have their baby see a pediatrician around 1 week or 2 weeks, depending on what's going on. And it's so great because midwives of my training, we're trained in normal. And so when something isn't looking perfectly normal, we know when to suggest to the family that they reach out to their pediatrician.
Mm-hmm.
But out-of-hospital midwives are trained to give babies the same postpartum medications that they would give in the hospital and do the same screening that they would do in the hospital at 24 hours. We can do at home. And for folks that did give birth in the hospital but wanted to receive out-of-hospital midwifery postpartum care, they can get that benefit of those really intimate home visits, even if they gave birth in the hospital.
Okay, so that was my next question. So even if you need to transfer, you still get the postpartum care. And what about lactation support? What is the sort of degree of lactation support that a midwife who is not also a lactation consultant, what can they provide?
Out-of-hospital midwives are trained in normal breastfeeding, how to support normal breastfeeding. And I think they're trained in supporting the common uncommons, the issues that come up. But once it's really veering outside of normal, she'll probably recommend that you see a lactation consultant. Many midwives in my community, including my practice partner, Jeannie Che, is also a board certified lactation consultant, which is such a gift to bring to people. But most midwives have pretty good lactation training, and certainly more lactation training than an obstetrician.
I would actually really love to hear about the partnership model of care and how that benefits families. I think it is related to postpartum because you actually would have more people who are within your known circle of support, and especially experienced and somebody who is clinically trained to support you postpartum as well.
Yeah, it's a partnership model like the one that I have. So I work with one other midwife. For us, we really feel like 2 heads is better than 1. And when we're working with a family, we love to have 2 sets of eyes on anything that's happening. And likely if one family has just given birth and we want to see them at the 24-hour postpartum visit, one of us is going to be really sleepy. And then having a partner ensures that somebody who's well rested can see the mom and assess her properly and assess her baby with kind of fresh eyes, and that we can kind of take turns assessing the mom's needs and her particular kind of clinical situation.
I really love that. I think for both doulas and midwives, any kind of on-call birth care, because labor can be so long and because there's so much support prenatally and postpartum that's required, I think that a partnership model is crucial to the health, well-being, and even safety of birth and of the midwives themselves, actually. I think that, I don't think it's so much crucial to the safety. I think that it's really crucial mostly for the health and well-being of midwives, because I think that a midwife who is a sole provider, who is a solo practitioner, can provide all the care necessary, but at great cost to her own physical, emotional, and even social self. So I'm very happy to see that our generation of midwives has learned from our elder midwives, and learned that maybe partnership is not such a bad way to go. I think it's smart, especially in a time when there's so much demand on what used to be a much simpler business. Now you need to be doing all these other things to keep up your midwifery practice besides just seeing clients and having babies. There's so much more organization involved with technology. So two things that you touched on that I thought were really interesting. So you talked about showing up at these periods of time, one of which was the 24-hour zone. And then you talk about, again, coming in 3 days later when the milk is coming in for breastfeeding, and how not just exciting that visit is, because there's a huge change that happens. The baby starts to kind of wake up a little bit from birth, from the recovery of birth. So now baby's got sort of coming into like a little bit of like, okay, now we're going to talk about sleep a little bit. We're going to talk about crying and baby soothing a little bit, which you don't so much have to do the first few days usually. We're going to talk about soothing mom, because mom also is having these huge hormone swings at this point, usually, right? Like the milk coming in and out is like, an explosion of all of these different chemicals in the brain, really happy, high chemicals. And also, on the flip side of that, some hormones that'll make you feel like sad to the point of even like despair for no reason that you can understand. So you're just so sensitive. It's like your nerve endings are on the outside of your body during that time. And the emotional support that a midwife can provide, again, as somebody who's been there since the prenatal period through the birth, I think is so unique to a birth experience, and that a hospital provider, unfortunately, just does not have the bandwidth to provide. What are your thoughts on that?
The hospital provider, and there's so many amazing hospital providers, and I will say they're really institutionally limited in the relationships that they're able to establish with their patients. And as a midwife, I have a luxury, and my partner has the luxury of getting to know a family over the span of several months over the course of their pregnancy. So I have a sense of what their unique history is and what's their normal emotional experience, so that when I see them postpartum and I am screening them for postpartum depression and postpartum mood disorders, and I'm really assessing kind of their wellness, I have something to compare it to, because I actually have a relationship with them, and it really helps me. And for folks that have a history of anxiety or depression, or have any relevant emotional history, I'm prepared to make recommendations based on that knowledge and hopefully provide far more individualized care. It really aids me in the care that I'm able to provide in a way that I imagine a provider who doesn't know their patient would be able to do.
I think it's so incredibly important. I've read some pretty staggering statistics on depression rates in postpartum women and in young mothers, and new mothers. Doesn't really matter what actual age they are. And I think that kind of care is crucial for our population of birthing moms. And then the other thing that you mentioned that I really would like you to talk more about is those visits that you're making. You are also be able to physically check mom. So when somebody gives birth and they're not being checked for 6 weeks, that means that whatever has occurred during that birth, whatever is happening in her uterus, whatever is happening at her vagina, the point where the baby has actually come out, nothing, no stitches are being checked, nothing. And I find that very distressing. I know a lot of clients who find that very distressing. Something that's been interesting to observe since things have switched to telemedicine during COVID is that I know a number of patients who I've encouraged to actually do a telehealth visit with their obstetricians prior to their 6-week visit, and people seem to be a little bit more open to it. But I don't know. I think that that's a real benefit, because once you get to 6 weeks, what I know from my background as a massage therapist is that a lot of your tissue starts to kind of gel around that 6-week period. So if you're going to do any kind of binding to help, like belly binding or corseting to help your organs come into place, if you're going to start doing any kind of very gentle postpartum Pilates or foundational exercises to help your organs come back into alignment and your muscles come back together around your abdomen to support your lower back and pelvic floor, you really want to start those with a lot of knowledge or with the help of a knowledgeable provider before 6 weeks, because that's when all the tissue is still totally open, soft, supple for healing. And I have to imagine that is also true if you're being sutured, if you've had any tearing or anything like that. The 6-week mark is pretty late to be checking those stitches.
I think that it's very late, and it's really around the 2-week mark that the sutures that were used to stitch up a laceration from childbirth have usually dissolved at that point. But you really want to be regularly assessing someone's repair to rule out infection, to rule out prolapse, to make sure that the laceration is well approximated so that everything was brought together evenly. And it really should be monitored every few weeks until 6 weeks postpartum. And I think that we wait till 6 weeks to give the birthing person or the postpartum person kind of the go-ahead for exercise. We want to make sure that a few things are checked off for more rigorous exercise, not like what you're mentioning, kind of like that building strength. We want to make sure that you're no longer bleeding from your placental site, that your uterus is back to its pre-pregnant involuted state, and that your vaginal laceration, if you had one, is totally healed. Because trying to move forward with returning to regular exercise with these things not healed can mean a lot more damage and pain later on, and incontinence, and far more issues kind of further down the road that can even affect subsequent pregnancies.
Mm-hmm. Okay. Well, I feel I'm sold on postpartum support at home. I think it's a really interesting option right now that is having a moment, because people are looking at other birthing options. And I know that there are a lot of questions about what the differences are in care. So I really appreciate you explaining all of that to us. And where can we find you if we have questions?
You can find me at eastbaymidwives.com, and you can also find us on Instagram, and our handle is at eastbaymidwives.
Okay, awesome. Thank you, Amanda Kessner. I really appreciate you being with us today.
Thanks, Sarah.